We'll give it one more minute and we'll get started. Okay, seeing a few minutes of afternoon here. Let's get started. We'd like to welcome everybody to our presentation, Navigating the EHR Landscape. We'll be looking at the benefits and challenges of traversing through this piece of health information technology. So the presentation is sponsored by BH Connect, and that's through Metastar. Presenters today will be Courtney Nazer and myself, Brent Amble. We're both project specialists with the BH Connect project. We look forward to sharing information with you, and there will be an opportunity for questions at the end, or along the way you can post them in the question and answer tab as we go through the presentation. That question and answer tab should be at the top of your Teams page. So go ahead and post in there. So we'll get rolling here. All right, so just a little bit of background. Historically, there has been a low adoption of electronic health records, or EHRs, in behavioral health, which has been attributed to multiple factors, whether it's a lack of financial incentives and technical limitations that restrict the ability to meet like the behavioral health field's unique needs, such as confidentiality concerns or staff and provider hesitancy to get into a EHR or to learn a new or different technology. One of the major components of this was the behavioral health was excluded from the HITECH Act. Most recently, there has been introduced legislation that does look at expanding the scope of technology in behavioral health nationwide. So knowing that it's difficult to pass legislation that never goes real fast, there has been a couple of different initiatives that have been introduced. One is the Behavioral Health Information Technology Coordination Act, or BHIT, and this would look at dedicating about $20 million a year in grant funding for the next 5 years. And this would benefit mental health, substance use disorder, and other behavioral health providers to purchase or upgrade health information technology and support services. So as we look at these initiatives, and the one I was referring to is coming through most recently looking at technology and how the interoperability and how different systems talk. There is a specialized component for behavioral health. So as we look at the objectives for today's presentation, we want to make sure that we cover all the bases. So first, we're going to present the basics of an electronic health record, or EHR. We'll look at discussing the advantages of utilizing an EHR, address challenges while demonstrating strategies when implementing an EHR, and then we'll also look at future and upcoming trends. So as an introduction and to level set, just so everyone is on the same page as far as what we're talking about. So for the EHR, electronic health record, an EHR is a real-time patient health record with access to evidence-based decision support tools that can be used to aid clinicians in decision making. So as background, and sometimes terms are used interchangeably, an EMR, which is kind of the first iteration of electronic medical record. A medical chart in this case referred to the record that's really not shareable. It was within an organization. Now, as we talk about the EHR, it's kind of all inclusive of all of a patient's health records, and it's incorporated across organizations. The EHR can automate and streamline a clinician's workflow, and then it ensures that all clinical information is communicated, and that can be within staff, whether it's providers to support staff to scheduling staff. The EHR can automate all of that. It can also help prevent delays in response that result in gaps in care. Think about a paper chart in a file cabinet or a file on a server that has been archived, and that can only be retrieved by certain employees, whereas through the computer or digital record, it can be at the click of a button. An EHR can also support the collection of data for uses other than clinical care, such as billing, quality management or data, outcome reporting, and public health disease surveillance and reporting. So there are many capabilities of an EHR platform, but for the purpose of the presentation today, we'll highlight a few components as they relate specifically to behavioral health. So as we look at the list here, cloud-based, that means the EHR platform is hosted on servers outside the facility. So usually provided by an EHR vendor or public cloud model. So a third-party cloud service provider such as a CSP. In this model, staff and patients can access the system from anywhere with internet access from a web browser or a mobile device. So a primary difference in a cloud-based or in web-native solutions, this eliminates the need for practices and facilities or organizations to maintain internal servers. They do not need to monitor the backup procedures, and it avoids a redundancy and resiliency protocol need so that you're able to access the stored data. So this is a little bit of a role reversal, whereas if you were keeping information on a internal server, you're responsible for that. Whereas for a cloud-based service provider, they're bearing the burden of protecting that data. So if there is a data breach or a HIPAA violation, the vendor is primarily held liable for any damage or the control of those files. Looking at a mobile platform, this will allow convenience for clinicians. The capability enables providing remote services, such as completing notes outside of the clinic. A mobile platform can also correlate into access for patients, such as opening up the option for a patient portal. A general EHR does not always relate to a behavioral health platform. There are options for creating specialized templates or adapting what is available within an EHR. But there are certain EHR vendors that are specific to and specialize in behavioral health. So these can include like coordinating services to improve health outcomes for a behavioral health patient. So because these technologies require a significant investment, you should not only consider how the right EHR meets today's needs, but also its ability to anticipate and adapt to future needs. And this really looks at that customization and being able to react to behavioral health needs into the future. Some workflow management discussion looks at specifically to behavioral health. It's important for your organization to know how to adapt to that behavioral health patient. So an example of this would be screening activities or related assessments that you want to have completed prior to an appointment or at check-in. And then these should be able to be accessed specifically within that EHR or patient record. Also, we want to maintain efficient information capture through like the treatment planning, monitoring ongoing progress notes. And also for behavioral health providers, want them to be able to benefit from tools that can take like the clinical data and then provide diagnostic support or integrate the appropriate clinical guidelines. And these can be done through meaningful reminders or through pre-populated reference information. So if you have more information at your fingertips through the EHR, you can better manage that patient. Also with the customization templates specifically to meet the roles of your providers, such as a specialized template for a specific note. Additionally, with the EHR, such at times for patients that need to have assessments done or reporting of scores within different measures. These can also be updated more in real time, and your providers can have access to them when needed. The last bullet point there, the HIPAA compliant. So a HIPAA compliant EHR has the capabilities to support HIPAA compliance. So it's configured to mitigate reasonably anticipated threats or hazards the security of protected health information, or otherwise referred to as PHI or electronic protected health information, EPHI. And this is used by the authorized members of your organization, and this would be done in compliance with the HIPAA rule. So for example, there would be separate login credentials for each member of your workforce. You're not going to have multiple employees logged in under the same computer using the same account. A compliant EHR is one that has demonstrated technological capability, functionality, and security requirements required by the Secretary of Health and Human Services and has received certification by the ONC, or now it has been renamed the Assistant Secretary for the Technology Policy and Office of the National Coordinator for Health Information Technology. And I just throw that out there. That's a lot of acronyms, but just to be aware that the ONC has been renamed. So the certified EHRs store data in a structured format, allowing healthcare providers to easily retrieve and transfer patient information. They can also create and transmit data in standardized formats and enabling secure sharing between health systems. One other component of a EHR that we'll not be discussing at length, but it's referred to as a revenue cycle management, but it really refers to collection of fees, billing. We'll mention it here, but we will not go in depth at this point. So, but this time I'm going to hand the presentation off to Courtney, and she's going to go through some of those benefits.
All right. You just want to click that first slide, Brent, and then I'll take them from there. All right, so let's look at the many benefits of an EHR. We will go through only a few in depth today. By a few, I mean 5. But in addition to into those, we're going to look at enhanced data security, better care coordination, increased client engagement, and especially a reduction in errors that we might see. So heavily into what we want to get into, we're going to look at streaming workflows. How to enhance the current process of scheduling, intake, check-in, clinician, and after visit with more efficiency and less time. We'll take a look at documentation support, such as templates and forms, which Brent has mentioned before. Importance of access to information. We'll look at the client portal capabilities and how this can reduce work burden for your employees, clinicians, physicians, peer support, list goes on. And then lastly, data availability. Through these benefits, you're going to observe improved client care due to comprehensive record keeping practices for better informed decisions, regulatory compliance, accurate documentation is better for audits and reviews. So when we look at data security and privacy improvements, due to controlled access to information, encryption, and improved backup and recovery options. And then lastly, we'll go through billing through features that EHRs can come with. You'll experience improved workflows and documentation so you can improve billing accuracy and improve your claims processing. So streamlining workflows. When I think of streamlining workflows, it makes me think of the term work smarter, not harder. Where we can improve in documentation workflow and client interaction, we should, right? So shaving off seconds of a typical workflow task could be seconds spent in client interaction or notes review, documentation. But if we shave that time off in notes review and documentation and intake, not only does that save you time, it will save you a headache, maybe even let the provider get a breath in between their next client. So it's very important. So this typical process that we see currently without an EHR, or maybe you might have one and you're not optimizing it yet, may go like this. A new client arrives at the clinic, they complete a paper-based intake form or it's sent to them via mail or email. They will then hopefully return it before the appointment day or maybe show up early enough with the paperwork. The clinician will manually enter the client's information into various systems, including demographics, medical history. The clinician will then conduct an assessment. They document the findings on paper, which is then manually filed or scanned into the system. If the client has previous records from another provider, the clinician must manually request and review those records, often resulting in additional delays. Now, with an EHR or optimizing of your current EHR, it can look like this. The client completes the intake form electronically before their appointment, which automatically populates the EHR with demographic and medical history information, dependent on your EHR, of course. The clinician reviews the pre-populated data and performs the assessment using standardized forms or templates within the EHR. The EHR automatically integrates the assessment data into the client's record, making it instantly accessible to other care team members. If the client has previous records from other providers, the EHR system can automatically retrieve and integrate this data, allowing the clinician to review the complete history in one place. Any necessary follow-up appointments, referrals, or treatment plans can be scheduled and documented within the EHR, whereas without one, it might be done manually, which then you're looking at phone calls, sending in faxes, letters. And of course, there are still agencies and systems that have those in place, and you might still have to utilize those regardless of you currently having an EHR, but that's why it's important for kind of everybody as they're all trying to kind of catch up to speed with this new technological era. So looking at documentation support, there are a few ways the EHR supports the clinician and providers, and that is in templates and forms. Progress notes and therapy notes are a central part of the patient care cycle, but documentation can be difficult to keep up with, especially with high caseloads. So we're going to review 2 great ways to enhance productivity and save time. So using pre-built note templates. If your EHR system has this capability, this is a great tool to use. You can create and utilize pre-built intake and assessment forms, patient demographics. Some systems allow you to set it up where it's kind of that page, that interface that you can go and fill it out, or you can create your demographics template with what you want in it so that it might open up with that name, that date of birth, their current doctor, physician, where they are living, etc. And then you're just entering in that personalized information. You can also pre-build out your risk assessments, SOAP notes, data assessment plan templates, or even notes for CBT sessions. This will save you time, whereas you may be opening up an original version of a Word document to use or having to copy and paste that base text of the notes you're building out. Then you kind of get into that fun game of having to save as if you're at a smaller clinic. And we all know that sometimes if you save as, something can be stuck on that page and everyone opens it up and there you are with compliancy issues. But this can kind of take that piece out of that. So you can customize them to your needs. Certain employees need specific note templates or even access to specific notes. Peer support may have a different note compared to the case manager note style. Within EHR, you can customize those to fit those employees and also grant access to who uses which note templates. You know, as a peer support, they might not need to see the build out of a psychiatry note or a case manager note or things that they don't need to be looking at. So keeping it nice and simple where you can is also important. You're going to be decreasing your time spent on recreating the structure of those notes and therefore decreasing your click redundancy, having to click and open and save and go through multiple things just to get that one note done. These templates and forms in EHR systems can ensure consistent, accurate, and comprehensive documentation, improve your compliance with regulatory requirements, and enhance your patient care while also streamlining your workflows within your mental health agency. Information, oops, we are flying through. Right. Sorry about that. Information access. So communication between clinicians and workforce are very important, as well as interoperability. Immediate access to information helps to identify individuals who need care the most within the moment risk scores by allowing users to define risk factors. Also customize rules for managing clients according to characteristics such as past suicide attempts or hospitalizations within the past 30 days. These capabilities provide faster risk screening and routing so that behavioral health providers can triage care where most needed. Being able to share records with other providers is a critical need for behavioral health providers. A client diagnosed with a mental health condition, substance use disorder, or other behavioral health conditions often will have coexisting health issues. For example, a client could be diagnosed with an eating disorder. They may have cardiac irregularities. In this case, the behavioral health provider and primary care physician or cardiologist working together is what will best serve the client. Risk factors in the client's life, such as a change in activity level, may prompt a joint discussion of medication shift or other interventions. So collaboration between a behavioral health care provider and a cardiologist, for this example, ensures comprehensive care. As care continues to become more integrated, these providers whose data is protected but not siloed in a behavioral health EHR will be best positioned for successful treatment of the patient. So having secure but open application interface is used for different software applications to safely communicate with each other. This is a critical feature for the exchange of healthcare data among providers. For behavioral health providers coordinating care with primary care physicians, this is crucial for their health. A mental health care client management system needs to reflect the full continuum of care being provided and how that interaction impacts the client care plans. So we will get into our patient portal. So, oh, sorry. So success of any treatment plan depends upon the client's level of engagement. Things like the ease of appointment scheduling, looking at their levels of engagement. Sorry, my computer is blanking out on my page. I apologize. So through the use of a patient portal, you'll see improvements such as improved patient engagement. They can access educational resources sent through the portal. They can complete forms, access treatment plans and records, keeping them informed and involved in their treatment. You can look at reduced administrative burden when utilizing a patient portal. Online forms and questionnaires can be completed by patients before appointments, therefore reducing paperwork for staff and save time during visits, allowing clinicians to focus more on that patient care. This can be convenient for appointment scheduling. Patients can schedule or reschedule or cancel appointments online, reducing the workload for administrative staff. This can be both a benefit and a barrier, though. Some patients struggle with making their own appointments. An example to think of is as a benefit is to think of somebody who is getting discharged from inpatient care. Most of the time than not, a social worker is scheduling their follow-up appointments. Some of these may not work for a patient when they do get discharged. Real life hits them. They realize that that's not a schedule that works out for them realistically. Having access to that option may decrease no-show appointments, especially following intense episodes and care, and increase appointment follow-up when a patient is given an alternative way to schedule or reschedule with their provider. A patient portal also allows for secure messaging. You can enable secure communication between patients and providers in a way that is compliant. This feature allows you to get rid of third-party apps that may be risking compliance with HIPAA. When using the patient portal features and capabilities, it's always important to also consider the patient's literacy levels. Do they need training on the portal? Do they have access to the portal? Do they understand login information? And do they have the technology to access the patient portal? So it's best to try to evaluate the use of the portal. It may be beneficial to most, but it could be a barrier to some. So don't weigh your work too heavily inside of a patient portal. Telling patients that they have to complete something inside of the portal in order to get a first step of care done. The portal should just always stand as an opportunity for efficiency on both ends, not only for the provider. So looking at reducing work fatigue as a benefit of an EHR, clinicians should spend most of their time with patients focusing on care rather than paperwork. By streamlining administrative tasks, behavioral health EHRs can free time for clinicians to operate at the top of their license. This is where we see that death by 1,000 clicks. We want to minimize repetitive documentation and enable efficient processes and workflow efficiency. EHRs can assist in streamlined progress notes, reducing documentation time. There is a reduced administrative burden through the use of automated scheduling and reminders for patients. You can see that there is billing and coding integration. There's also centralized patient records. So that falls into that efficient data retrieval. It reduces that cognitive load on the clinicians that they would otherwise have to perform manually. Some records are kept in different places. So through efficient record keeping, this keeps the load down when a patient or clinic requests all of those records at one time. Through seamless sharing of patient information within the features of interoperability, you also reduce the need for repetitive documentation and additional coordination. So looking at the availability of data, this is information to make decisions. This assists with quality improvement initiatives, incorporating application programming interface. So if you hear that API, that is what that stands for. And then also incentive options. API data is essentially the information that is sent, received, or manipulated through API. It enables different software systems to communicate and share functionalities efficiently, providing seamless integration integration and interoperability across various platforms and services. So can software A with data talk to software B, and that's where that interoperability comes together, and you're able to share records with different systems. So behavioral health providers can also benefit from tools that will take clinical data and provide diagnostic support, integrate appropriate clinical guidelines, and prompt you with meaningful reminders and aids reporting and aid reporting by pre-populating reference information. Mental health providers, substance use disorder clinicians, and others practicing in behavioral health settings need infrastructures that can effectively and accurately reflect a client's health before and during treatment. So this will require accurate and complete capture of the client demographics, appropriately timed screenings. You can look at diagnostic and assessment workflows, as well as structured data and progress notes. So available data will assist with having access to that comprehensive patient information and allow for shared access among providers. Again, streamlining the management of that information can enhance that client's care. So this will also pull right into improved follow-up and monitoring, enhanced decision-making, and efficient crisis management. So access to that psych history, those current medications, those past interventions that a client has utilized in the past. This helps with real-time transparency, and it decreases the likelihood of inefficiencies and preventable errors, such as test duplications or diagnoses formed by incomplete information, which we all know can be very common, especially when there's a patient or a client in an active mental health episode and they struggle with that historical information when trying to report it for themselves. So behavioral health organizations depend on meaningful data to identify performance trends and recognize best practices and drive widespread improvement. The right technology will support gathering and tracking quality performance at an individual and population level. And now I will hand it back to Brent.
Courtney. So as Courtney outlined, there's many benefits to having an EHR, and especially when everything is working right and going well and like a well-oiled machine. And going back to the general checklist and the benefits that Courtney discussed, we want to convey that EHRs can specialize and have different options. We need to know that there are different capabilities, just such as you have different shoes that are specialized for different activities. EHRs do come with behavioral health specialties, or they specialize in behavioral health itself. So recognizing that the EHR may be best suited for your organization, not only now, but then also into the future, and making sure that it's the right fit. So part of the process is just knowing that there's different options out there. If you're in the market for searching for a new EHR, or even if you have an EHR and want to optimize it, there may be new opportunities or options such as templates. Along with that is we have here ready for change. An EHR can be a cultural change, and for an organizational culture or buy-in, this is very important across your employees. Your employees are a valuable resource, and we want them to embrace the change. So they're just like that new pair of shoes, there will be a break-in period, and that needs to be realized. Commitment to the use of an EHR needs to be supported by administration, clinicians, and support staff. It's got to be across all levels, and this will result in not only embracing the change, but the support of the new EHR and having it be successful relies on this. So we found a study, this was done by Medical Economics, but it looked at that at least 70% of physicians were unhappy with their EHRs, and the numbers don't really matter as much as why this was. And they didn't want to switch to a new system or to use a new user-friendly system, and they were deterred by, one, costs. A budget is always an issue, but also EHR training curves. It's not like you can just jump into a new document and start working on it. There is some training that has to occur. With the functions of an EHR, we want to make sure that that implementation can be successful. And when we look at templates that can be tailored individually to an organization, like a pre-built template option that you can change to your workflow, this will definitely get the buy-in of your employees because it's going to make their work more efficient. Then also having the results of like an assessment available, that'll also help in getting them to buy in. Listed there for aptitude for learning. Courtney touched on this, and this can include patient literacy. If you have an EHR and your digital system, but you have certain patients that aren't able to access it or be able to use it, that's a challenge. The same goes for your workforce. The possibility is that you may have employees that are not as apt to, catch on to a new computer system or new note systems or the new scheduling system. So then in this instance, we got to make sure that the training is available and that the reasons for the change are conveyed to your staff. Additionally, they're noted as technology and security. So organizational policies and procedures also need to reflect the current situation of technology. So this would be, in the case of an electronic health record, needing to protect that personal health information or the protected health information of your patient. So the security needs to be there, and the training behind that and the implementation of these procedures needs to occur. So we want to think about a cybersecurity incident leading to downtime. Is there a contingency plan? Not necessarily going to expand on this today, but it is something to talk about and think about when you have a electronic health record. So having talked about challenges and also the benefits of an EHR, one is how to get started or how to implement this EHR we'll discuss here. So first off, if your organization is looking for an EHR, first you need to determine the requirements and what features are needed or are priorities for your practice, such as how big is your practice, how many patients, patient volume, number of providers. Once you've determined these preliminary questions, now you need to narrow down the EHR options. So there's many resources available for this. One, our BH Connect team has looked at various resources, have developed resources and available for assistance in this. Also, there are technical advisors, by just reaching out to EHR vendors, they can provide answers, although there will be slight bias if you're talking with a specific vendor. And then also talking to your peers. Who else has the same EHR? Who else is looking at or has in the past had an EHR? You want to be able to ask the questions, as this is a significant investment for your organization, and some other thoughts to think about and questions to ask yourself. Is it reputable? You can check the reviews. There's much information out on the internet or through different peer connections that you can look at to determine these answers. Looking at the EHR, is it certified? Is it compliant with healthcare standards? This can be found on the internet, either through the ONC website or through different channels. You can look at customer support. What are their, what's their, what would the contract entail? If you contract with an EHR vendor, do you have ongoing support? That's a question to ask. And then also looking back at the capabilities, looking at what features are available today and what features would be available in the future, and does that align with your needs and priorities for your organization? So some steps to the process, what you can expect. So first off, developing a budget. Unless there is no ceiling, you need to look at the possible costs. This is going to include licensing, implementation of the EHR, ongoing initial training and ongoing training, maintenance of the platform, and then also as the costs go up, if you have more providers or if you add services, what would that do to the contract? There are a couple different ways of the costs for an EHR. One is like a subscription, you just pay a set fee per month, or it can be provider or per staff member. Also, you want to ask or budget for, are there any third-party costs? So such as an EHR vendor does not have an app for a part of the online portal or a patient portal. Would you need to contract with another vendor, and then this might add an additional cost? So as our team has looked at, we've developed kind of a database of available EHR vendors, and there's over 150 options. So narrowing that down can be kind of cumbersome, but through these questions and kind of what benefits you're looking for, it can be into more of a manageable number. Once you've developed kind of that criteria, how to narrow it down to a few choices, and you decide on a EHR vendor, you will have to negotiate a contract. And this is going to include some legalese. So having available counsel or within your organization, somebody responsible for that. In terms of time, 1 year, 2 year, 10 year. This is a significant investment in the future, and knowing that it's difficult to get out of a contract. And just realizing that the timeline is probably longer than you think. So budgeting both for costs of the EHR vendor and also budgeting the time needed for the organization. So once you've decided on an EHR and you're implementing it, or maybe you have an EHR currently, the optimization of it really looks at the training. And this is where your staff and your organization learns the EHR and really gets to know the ins and outs. So with the training, and we'll credit coresolutions.com for some of this stepwise approach to training, recognizing the quality of that training is going to be important for your staff adoption. So if it's insufficient or ineffective training, it's going to result in misunderstandings, and you're not going to be able to capitalize on all the capabilities. When users believe that the new EHR is hard to operate or navigate, it's going to put up roadblocks, and utilization of it is going to be poor. So the best way to implement an effective EHR training is first, create the EHR training plan and be able to follow a timeline, what that plan is going to entail, and how to ensure that all of your staff gets the training that they need. Second, simplify the training approach. So knowing that not everyone learns the same way, there's going to be different approaches that need to be taken, such as on-the-job training, classroom training, virtual training. All of that can play into it. And through your vendor, they should have these implementation opportunities, or it would need to be contracted. Some of your staff are going to be not as technology savvy, so they're going to need more assistance, and some others are going to take to it a little bit quicker. The third step is going to be your ongoing training. And this is whether something new is going to be introduced, such as a new capability, or just as new staff members come on, how are they going to be onboarded to know how to use your EHR? One opportunity that you do have with implementation of an EHR is to turn some of your existing employers into super users. So if employee A has a question, they can turn to a super user that works in the department or within the same office, and then they can assist through some training opportunities with that. Some things to keep in mind for training: it's critical for implementation to have an appropriate amount of time, and that organizational leaders need to consider that employees have the appropriate time to learn these things, and that may affect everyday workflows, and that's going to lead to some downtime for the organization, possibly not as able to see as many patients during a certain time of the implementation. During the blocks of learning, it should be uninterrupted. The employees should only need to concentrate on the training itself. So organizations should have a plan for maintaining success after the EHR goes live with the new platform. So although end users may receive proper training, they are also likely to have questions or need additional guidance the more they use the system and encounter unique situations. So this is kind of the on-the-job training. And this goes back to the vendor and the terms of the contract with ongoing support and into the future. So looking at how to have a successful EHR, it's really from the start to the finish, knowing that really there isn't a finish line because there's going to be that ongoing training. Just a couple of things to look at as we keep our finger on the pulse of the future. If we all had a crystal ball, we'd know where we're heading. But right now we can look at some trends that we can see. And so within an EHR and like health information technology, you know, a buzzword, and it's here to stay, but it's artificial intelligence. Everybody has heard of probably AI. It's used to create custom-built features with numerous benefits for patients and clinicians. And really what AI is, it's a complex algorithm and software through machine learning, it can develop data, and this could be used such as like where a virtual scribe documents an appointment. So, you know, looking in the future, maybe notes are more automated and they'll already be done by the time the appointment is done. Another example of a future trend is value-based care arrangements. So where EHRs with evidence-based prompts specific to behavioral health, you'll be able to collect the data. It will load into measurement-based best practices, and you'll be able to get data from that. And then with the base care arrangements, you'll be able to put into dashboards data that will help with possibly collecting on fees or through programs to work with the collection of fees through that arrangement. Another topic is social determinants of health. This information takes into account factors like socioeconomic status, education, and environment, and the ability to capture within the EHR will be a valuable resource looking at that data capture. Evidence-based decision support. This is where evidence-based prompts can be built into the behavioral health workflow, and this will provide timely access to practice protocols and then helps providers align their care plans within clinical best practices. Cybersecurity, we mentioned on that a little bit, but there's a saying, not a matter of if, but when there will be an incident resulting in a breach. This poses the question of how does the EHR respond to an incident resulting in downtime, and what does the preparation for this possibility look like? Scalability and future growth. This relates to what will your organizational need in the future? And will the EHR be able to grow with the ever-changing landscape of digital healthcare? And lastly, telehealth and mobile access. So we did not specifically mention these components at length. Having the ability for patients to access care will meet a demand when and how a patient can get quality evaluation and treatment with a convenience factor. So really looking towards the future of what the capabilities of an electronic health record will be will really depend upon what is available within those capabilities and how an organization can capitalize on them. So in general, when working with an EHR, whether it is selection, the implementation, or optimization of that platform, it is valuable to get input from all employees. This includes buy-in from the bottom to the top, and it is important for the organization to have that buy-in and embrace it, because if you're having all of your staff working together within that integrated EHR, it is going to equal efficiency. And that's really the goal, for everyone to practice at the top of their license, but not be overburdened by fatigue from utilizing the EHR. So with that, not seeing anything in the chat or any questions posted. Anybody have questions of information that we covered?
I think there's a lot of good considerations and information. I'm wondering if you'd be willing to share the PowerPoint with attendees.
Yes. So here you can see our information about the BH Connect team. And this includes our team email, and link to our online community platform and phone number, or easy click with the QR code. But with our BH Connect team, we can assist your organization with selection, the implementation or optimization of an EHR. And part of that is you can expect a follow-up email from our BH Connect team, and that will have a link, or we'll have a link to the PowerPoint that you'll be able to access that.
Okay, great, thank you. What would support in those areas look like? How much involvement would you guys be able to provide with those processes?
Yeah, great question. So the support really depends on what your organizational need. The BH Connect project, and this includes our team, and we've got a number of them on the call today. We really meet your organization where you need it the most. So we've developed resources, whether it's selecting a vendor. We've got in our database over 100 that we've of some sort looked at, or maybe it's optimizing your current EHR. So it really depends on what could be of most assistance to you.
Carrie,
Now
this is, I just
sorry,
wanted to
Melanie.
ask you where you're from and everything, because you can reach out to us as well. But if you'd like us to reach out to you with the slides and everything, that would just put that in the chat.
Sure, thank you. I work for Dane County.
And just to add on to your question, Carrie, like Brent said, meeting you where you're at. So whether it's kind of brainstorming and looking at what capabilities you guys want to have, if you want us there in that meeting with a vendor, if you feel like there's different questions that we could ask, sometimes you don't know what to ask if you don't know what's available, and so on and so forth. We can really go through it with you. And I want to say hand holding, because obviously you guys would be the number ones to make that decision at the very end of everything and throughout it. But yeah, as much assistance as you guys need in terms of looking for one that would fit, brainstorming the needs for your county, and how to get to that next step. And if you want us to continue on those steps with you, we would assist with that. And even if you do pick one, getting to know that system, well, so that we can assist you with it while working with your vendor holder, whoever that might be.
Thank you. I'm also curious, like which systems you guys have experience with. And I know that's like probably a general question for a big group of people. But if there are maybe a couple that you're more familiar with than others.
So I'm pretty familiar with NetSmart Avatar. I've used it myself as a social worker. I've also used Epic personally. I used Therapy Notes personally, but we've also looked at like eVantage. We've looked at Tebra. We really have it, like Brent says, it's really housed in our resource. So if we sat here and we just list every capability of them out, you know, we're sure going to mix them up. And then Brent, he can add on any ones that he's personally worked on. But as we go through them, we've been trying to do full demos with those account holders, as well as whatever resources they have available on their websites that we can obtain, so that we're able to provide those as well to you guys.
Thank
Any
you.
other
Appreciate that.
Yeah, any other questions? Well, great. Thank you everyone for joining. As we had mentioned, you can expect a follow-up email from our BH Connect team, and that will include a survey, because it's really helpful if you can provide some feedback, especially for future presentations or opportunities for us to share information with you. And we'll also be following up with you with the information, and we look forward to connecting. So thank you, everybody.
Thank you.